Good morning, everyone, and happy Wednesday to you as we continue our conversation of the transformation of mental health through social work or health, and creating a more inclusive experience of care and treatment services for everyone. I think, what's come up for me over the course of this past week and in some of the sessions we've had, in some of the meetings we've had, is the idea and a post that one of our members um, put in our members chat box, our group chat, has been about collaboration and what the role of collaboration is in this, and then expanding that into what the role of collaboration and community is in the transformation of mental health. And again, this is all sort of conversations that we're having, exploring things from different lenses to see what would a transformed mental health system look like. And some of it that, and again, leading to a conference, a panel discussion. We have our social work power certificate course and other conversations we've been having on a regular basis. And you're welcome to join any of those conversations. You can email us at contact@sweetinstitute.com to do that. If you want to have an additional conversation with us and what your views might be of the transformation of mental health through social work. And so when I think about what this process may look like from the lens of both community and collaboration, as being, I guess, two parts of the same process. It really is, if we are looking at, one of the conversations we had several weeks ago, and a post that we did quite some time ago about this was about, what other cultures and what other places across the globe seem to have a process that works in perhaps a more innovative way than we do here in the US. And so some of it has been about the community taking responsibility for the individual, and then really thinking about how did that happen, right? How did it happen in the areas where the community does take responsibility for the individual? Was it something that was explicit? Was it something that was implied? Was it something that was just part of the culture of the community to begin with? How did buy-in become part of that process? Because when we think about communities where there's much more collectivism and communities where there's much more individualism, transforming an individualistic community into one that is more collectivism also requires a culture shift and a buy-in from multiple levels, right? We have our leaders in communities that are named leaders, right? And then we have the covert leaders in communities that are the ones that really get things done. Now, that isn't always the case, but many times it is. Organizations sort of can operate the same way as well. And so when we think about a community taking hold of, of the well-being and the health of everyone in that community, how do you get buy-in for that in communities where there is a much greater sense of individualism than of a collective experience? It also made me think of community policing, but in a different kind of way. I'm thinking about it, where community members people who lived in the same communities they were policing, and thinking about how expanding that where people who live in whatever that community is work in that community as well, right? And would that participate in sort of this community construct of everybody taking care of everybody in that community. So I think for me, you know, I'm just kind of toying with different ideas and different thoughts about partnerships and how to create how to not create, but how to, because I don't know if it's about creation. You know, I'm really sort of in the thinking through process of this, right? But really considering if part of what we are looking at is this idea of the community taking responsibility and things being done on a community level first, right? What would it take to create that as an ongoing process when there might be and a fully inclusive process, and that's it, right? Like, how do you create that where you have buy-in from the community and from all your partners in the community to take care of each other and to look out for each other, and not because it's something that you are tasked with doing, but something that is inherently part of what you think is important to the sustainability of everybody in your community. So those are my thoughts for today, ever evolving. Thank you for joining us. I look forward to hearing what you think about this. Please feel free to put a comment below. And I look forward to communicating more with you next week about social work power and the transformation of health and mental health through social work.